afternoon. Hi, I'm Siobhan, and I came to do a skin, hair, and nails assessment along with the oral, mouth, and nose assessment as well. I will come into the room, introduce myself as Siobhan DeLay Wills, family nurse practitioner student, to Mr. Cawthorn. Mr. Cawthorn has already received his vital signs and have gotten a past medical history and subjective and objective data obtained. I would enter the room like I did and introduce myself, and then I will wash my hands in front of the patient. Okay, I'm back. I will start with the skin, hair, and nails part of my assessment. I would start off at the top of the head, and I would inspect the scalp for lesions. I would, go through the hair, check in for any abrasions, any abnormalities of his scalp. Also, I will check the distribution of his hair, the hairline, and just the hair follicles, and go from there. I would take his gown down, check his skin turgor, to check for dehydration. I would also, since I'm back here, I would inspect the back of the posterior portion of the patient's back for any lesions, any abrasions, lacerations, any type of abnormalities. I will then ask the patient to stand. I will check the back of his legs, for any rashes, to make sure there's no redness, skin discolorations, any lesions or abnormality, moles, and different things. And I will also document any tattoos or anything like that. So I would ask him to sit, Mr. Cawthorn, to sit back down. I would come to the anterior portion of his body and inspect his skin. And at the same time, I will be kind of, checking and keeping, hand to skin to skin contact with the patient, to check for any perspiration. I will check the palms of his hands, no sweating, no excess sweating. I will check the skin folds, lift them up for, just check and make sure there's no lesions or anything, abnormalities on his skin that I'm concerned for. I will come to the front of the patient's body to make sure everything is symmetrical. Look at the trunk, no rashes. I will check his skin turgor, just to see if it bounces back. Just poor skin turgor would mean dehydration. I will check his cap refill on his fingers, make sure they're less than 2 seconds, and they are. No lesions, no hangnails, no abnormal skin problems. I will check his feet, the soles of his feet, and I would also, just check his entire body, his skin portions, for abnormalities. Okay? Alright. I will use the dorsal aspect of my hand to go back and forth, checking his skin temperature and making sure that, he has normal skin temperature. I would check the chart to make sure that nothing was reported. Step back a little bit. The patient, seems pretty clean, no odor or anything like that I could smell. I think that will complete my skin assessment at this time. And then I would move along to the nose, oral, and mouth assessment. I will start by, just making sure, looking at the nose and making sure it's midline, it's symmetrical, no lesions outside. And then I will put some gloves on. Okay. I will start out by assessing the oral mucosa, and that's a continuation of my skin assessment as well. I would ask the patient to open his mouth. I will look at the top and the bottom, and also just making sure, checking for dental caries, the roof of his mouth, no lesions, no excoriations, no redness, swelling of the gums, the teeth, no dental caries. And at that time, I would also ask the patient to lick out his tongue and say, ah. Ah. Say, ah again. Ah. And at that time, I would try to visualize the fairness in the back of the throat. Lick it out further. Ah. Ah. Okay. Side to side tongue. And this is also checking for the cranial nerves. I would ask him to lift his tongue and check the palate. No lesions, no abrasions, no cuts, scrapes, or anything like that. No discomfort when I palpate the inside of the mouth. The lips are fine. The tongue, I've looked at the bottom portion, the top portion of the tongue. No lesions, no scrapes, bruises, or anything to the lips, mouth, outside of the nose. I would also look at the I've already looked at the symmetry of the nose. So what I'll do now is take my light and look at the back of the throat with the light. Lick your tongue out for me. Okay. Nothing seems to be abnormal that I can visualize. I would palpate his sinuses, frontal, maxillary. Any tenderness there? Okay. So at this time, I'm going to turn off the light so I can do some transillumination. Even though I have not perfected that, I have tried to practice that over and over again. So the light's off. And that just gives me a better visualization of the sinuses to make sure no fluid is behind the sinuses. And so okay. No tenderness, correct?
No.
Okay. All right. It seems as if I have completed my skin, hair, and nail assessment along with my oral mucosa. So I'll start with the cranial nerves portion of the oral nose and mouth assessment. I have come up with some bitter, sour, and sweet testing cups. And Mr. Cawthorn will tell me whether or not these, he will be able to identify. And this is checking his cranial nerve 1. Okay. First, I'm going to ask Mr. Cawthorn to swallow. And this is just plain water. Okay, and no pain with swallowing?
No.
Okay, he swallowed with no problem. Okay, now I'm going to test his sense of smell and his sense of taste. So I would also check the patency of his nostrils first to make sure that they're patent in order to do a sensory assessment. Breathe out, breathe in, blow. Okay, his nostrils are patent. So you would just tell me what this smells like.
Water with lemon.
Okay. I just dashed some lemon flavor in some water, a little small amount of more water, and he guessed it is lemon. Okay. And so I also have a cup, and this is going to be between bitter and sour. And he's going to taste these.
Bitter.
Okay. That's the bitter taste. Do you need some water with it?
No.
Okay. All right. And if you would tell me what this one is.
Sour.
Sour. Okay. Now, at this time, I'm going to look up his nostrils to make sure there's no lesions or any type of abnormalities inside of his nose. And I will use the largest receptacle. And I would ask him to raise his head a little bit. And I would just, just put the receptacle far enough just to, visualize the nose. They're patent. Just a little bit of mucus, but nothing major. And here, just a little redness, but nothing major. Maybe from blowing his nose or sneezing. Okay, you can put your head back down and relax. Also, I just wanted to let you guys know that I have finished my skin, hair, and nails and oral, mouth, nose assessment. Any questions? I guess none. Thank you and have a good day.